Everybody, can everybody see that okay?
Yes, thank you.
Perfect. Okay. So yeah, like Amy said, I'm Kathleen. I'm the knowledge translation and for now the patient engagement lead for NL support. So for those of you who aren't kind of familiar with our work, NL support is a health research support unit in the Faculty of Medicine at Memorial University in Newfoundland and Labrador. So I don't want to spend too much time today talking about what we do. And many of you may be familiar with the work of SPORE support units, but an important piece that I wanted to highlight was basically just that we exist as a resource for folks who are doing health research. So for those of you who may not be located in Newfoundland and Labrador, there are support units just like us across Canada that also would serve as a resource for you in your region. So I'm going to place a website in the chat. So hopefully that goes through for everybody. So you can visit that website to find information for the unit that would be in your area. If you just scroll down to the bottom of the page, you can find all of the details for the different units across the country. So our outline today is I'm really hoping to kind of inspire you to think about different ways of sharing your research findings with your target audiences. But we're going to first go through a quick overview of what knowledge translation, or KT, is, different types of knowledge translation, and we're going to define knowledge users. But I really want to focus a good portion of our time highlighting some non-traditional examples of knowledge translation and some ideas of considerations for producing a similar knowledge translation product. We're also going to talk a little bit about considering your knowledge translation strategy based on your target audience. And then I want to leave some time at the end for discussion where I'm hoping that some of you may have brought some examples from your own work that you'd be willing to share so we can learn from each other. So we're going to start first with a definition of knowledge translation. So this definition on the screen is the definition from CIHR, which is the Canadian Institutes of Health Research. So it's fairly long, a little bit technical, but that's their kind of official definition. So I just wanted to break it down a little bit more. So basically, the process of conducting research produces and synthesizes knowledge on a topic in many different ways. And ultimately, what we really want to do is take all that work that's been done through research and get people to actually use it. So in health research, we want to have those findings affect practice in some way. So that might look like changing a policy at the government level. Maybe it's a tweak to clinical practice guidelines in a specific area. And this is where knowledge translation comes in. So basically, KT is the process of getting research results into policy and practice. And when we think of that whole process of research to practice, there's two areas where we typically find that there are knowledge translation gaps. And these tend to contribute to research not making it into practice. So we have a gap here between bench science and clinical science and knowledge. And then between that clinical science and clinical practice or healthcare decision-making. So the goal of an effective knowledge translation strategy is to bridge those gaps to make sure that the learnings from bench science make it into clinical science, and from clinical science make it into decision-making and clinical practice. So knowledge translation looks to be that bridge to get your messages about your research into the hands of people who can use them. And part of bridging those knowledge translation gaps effectively is to reach the appropriate audience with your information. So you need to know who those people might be, and then also how to craft appropriate messages for the specific audiences you're looking to reach. And broadly, we refer to those audiences as knowledge users. So when we talk about knowledge translation, there's kind of two phases of a really effective knowledge translation strategy. So we have integrated knowledge translation, and that occurs throughout your research and really helps to shape your research so it can best meet the needs of your knowledge users and have the greatest chance of success. This often requires more work, but we really believe that the improved outcomes make that extra work worthwhile. And another thing that we're starting to see is that funding bodies are starting to see the value of integrated knowledge translation. And so they encourage researchers to incorporate IKT into their funding applications. So in addition to those benefits that you see, you might get some cookies from funders in terms of doing your research this way. So a big point that we like to stress about integrated knowledge translation is to start early. So you really want to start early to maximize the benefits of your knowledge users' perspectives. And sometimes this looks like developing relationships before a specific research project has even been developed. And I've got an example later of a project where that kind of happened. And end of grant knowledge translation, I think, is what most researchers are very familiar with. That happens at the end of your project to disseminate your final results out to the relevant knowledge users. And this has been kind of the typical way, I think, of thinking about knowledge translation. And what usually comes to mind are things like journal articles and conference presentations. But when we think about getting research results to people who can actually use the information, it's important to think about who they might be and what would resonate with them. So if you're not looking to reach other academics or researchers, a conference presentation or a journal article might not be the best way to do that. And so hopefully after today, you'll have some ideas of alternative knowledge translation products to consider. So I've mentioned working with knowledge users a few times. So what does that actually mean? Knowledge user is a fairly broad term. And so when you're thinking about your research, really consider who might be relevant to provide input on your topic or components of your research. And so I've got a big list of examples. That's certainly not an inclusive, all-encompassing list of people who might be knowledge users, but just some examples. But any of those people who would be relevant should be people you consider engaging with as part of your project. And so you also want to consider when they might be most relevant to provide input. So some knowledge users would be really useful to engage throughout your entire project, and then others you might only engage for a specific part of the project. And that can be dependent on who they are, their interests, and also their availability. So for example, if you were wanting to include a healthcare administrator, they might be too busy to be fully involved in your project, but you may be able to touch base with them at specific points along the way for feedback to ensure that you're on the right track. And then the other thing that I think is important to consider is the level at which you're going to engage those knowledge users. So this spectrum is a good way to visualize and communicate how you might plan to engage your knowledge users. So you can see on the left there, we've got the lower level of engagement of inform, and then all the way to the right, the highest level of engagement is empower. So again, this can be dependent on your knowledge users' interests and availability, and also the ultimate goals of your project. So if you're only looking to get information out there, then inform is perfectly fine. If you really want to work with people to change the whole system, then you might be looking to involve, collaborate, empower. So I don't want to spend too much time on this, but if you do want to find more information about this engagement spectrum, the International Association of Public Participation has more information, resources, and training on this. So if you just Google them, you'll get to their website. So on to our examples. So this first example here is a comic book that was developed by 3 graduate students who received CIHR funding for a project to improve knowledge translation for LGBTQ+ communities. And the goal was to present research in an accessible way. So they chose to do that as a comic book. And the comic book explored how to improve the emotional, mental, and sexual health of queer men by talking about body image in relation to weight and muscularity. Some highlights of this project that I thought were hopefully relevant for folks who are thinking about doing kind of out-of-the-box KT. So the artists that they used for this comic book were all queer artists, and they had 40 different artists from 7 different countries featured in the comic book. And these artists depicted both their own firsthand experiences as well as information from peer-reviewed literature. So this is a really great example of pairing up with other people who have skills that your research team might not have. So they paired up with these artists, knowing that maybe none of these graduate students had kind of this artistic background. And then another piece is because the artists are all members of the community that they were looking to reach, their involvement would help to broaden the reach of the product to a wider swath of that community. And because these are people all over the world, they've reached that community worldwide. So something to consider is that having members of your desired audience involved in the project can help with buy-in from that population. And in particular, if it's a population that tends to feel misunderstood or othered, having somebody from the group can help to have buy-in from the rest of the population. So just something to consider when you're thinking of who to engage in on your KT products. So our next example is a project on an Inuit approach to palliative care. So this was done in the community of Sheshatshiu in Labrador. So in the picture here on the right is Dr. Russell Daw, and with him on the left is Jack Panashaway, who is a community member and lives in Sheshatshiu. So Russell was working in the community as a physician, and he really wanted to engage in a community-based Indigenous health research project, but he didn't have a particular question in mind. He just wanted to do this kind of community-engaged research. And Jack and another community member named Mary Pia had identified this topic of palliative care as a community need. And so a local family physician who had worked in the community for years kind of facilitated the introduction of Russell and Jack. And that's what really got it all started. So Russell and Jack are co-PIs on this project, and the community has been very involved throughout the whole project. So they have an annual advisory committee, and all the decisions about the project are made with agreement from both the research team and the community. So that's a really good example of integrated knowledge translation. They're embedded in the project the whole way through, and also that empower level of engagement. So Jack, as a community member, is empowered to make all the important decisions along with Russell on this project. And they started developing their relationship before they actually got into the project. So I think they were working together for about 2.5 years before they submitted ethics approval for this project. So that's kind of an example of developing a relationship before you've even gotten into your research project. So the knowledge translation product, one of them, they've wrapped up that kind of their initial phase of the research, but what they've got now is they've commissioned 2 paintings by an Indigenous artist. So one of those paintings will hang in the community and the other will hang in the Faculty of Medicine at Memorial University. So the reason that they chose to have paintings commissioned is because not all community members in Sheshatshiu read or write in any language. And it was really important for them to have their research findings be accessible to everybody. So art was the way that they achieved that. Their original plan was also to have a large community meeting during their annual gathering on the land. So again, that cultural knowledge about the fact that this is a really important community gathering, and so this would be a great place to go to people, share their findings, discuss them with the community. Unfortunately, COVID thwarted that plan, so they ended up having just a local community meeting to discuss their preliminary findings. And they also invited staff from Labrador Grenfell Health, which is their regional health authority, to attend the meeting. So those would be other knowledge users who would be important to make some of the changes that would need to happen around changing the way that palliative care is done in the community. So I thought these 2 different KT strategies were a good example of having multiple strategies to reach different audiences, taking into consideration their specific needs. And again, having that firsthand knowledge by having people engaged in your research throughout the process allows you to make sure that you're meeting the needs of your knowledge users. So our next example is a breast cancer example. So this research team was studying breast cancer surgical choices, and they had research participants create a video diary about their surgical decision-making process. Then they developed a script based on the content of those video diaries, and they had knowledge users, including patient partners with lived experience, as well as some of those research participants, provide input on that script to make sure that it kind of made sense. Then they used the script for a play that the team used to do help present their findings to the general public. And a thing that I thought was really cool, they had a couple of the participants in the research actually act in the play alongside professional actors. So the play was a really great strategy to share research results in a unique way and reach a different group of kind of the public. It was received really well. And the production team has actually completed a digital version of the play. So if you were curious, you can check out that link, themultisensorystudio.ca, and you can view the video online. So again, like the comic book example, this is another one where being aware of the skills on your team is really important. So this research team paired up with a local theater company who really took the reins on the production side of things. So a thing to kind of consider in a big knowledge translation product like this is considering the budget that might be required, which is one of the values of engaging your knowledge users as early as possible. So if they identify a particular knowledge translation strategy early on, you can start working those costs into your budgeting from the beginning. But another thing I wanted to highlight is that if you look on their poster, it's kind of small probably for you, but you can see Arts NL is listed on their poster. So they were able to access pots of funding that would not normally be accessible to a researcher by doing this non-traditional knowledge translation. And so having these connections, so in this case, somebody in the arts community who is familiar with available arts funding, helped them to navigate the process of accessing some different money to help with this kind of pretty big knowledge translation product. Now, the next example I have is a video that I'm hoping is going to work for us. I'm just going to show you the first little snippet of it because it's 5 minutes long and you'll get the point after about a minute. So I'm hoping, just pop something in the chat or unmute yourself if you can't hear, but we tried this out beforehand, so it should work.
Health Accord NL is reimagining health in our province. Guided by 6 strategies, together we will make this province a healthier place for all Newfoundlanders and Labradorians. Each of the 6 strategies can be represented by a puzzle piece. Right now, we have all the puzzle pieces, but they are different shapes and sizes, and they are not working together as they should be. When we try to make them work together, they just do not fit, and they certainly do not make the stable structure needed to represent health needs in the province. Listening to the people of the province, Health Accord NL wants to reimagine how the pieces can work better together to create a more stable structure that will ensure better health and health equity. First, let us look at the new directions imagined for each puzzle piece. Then, we will imagine how they can be better integrated.
Okay, so I'm going to pause us there because that kind of gets the point that I wanted across. So this is another example of integrated knowledge translation. So this is a video that was used in an early public engagement session on the work of the Health Accord. So you kind of heard a little bit about what Health Accord is about. So it was a team pulled together to provide recommendations to the provincial government on reimagining the health and social systems. So these public engagement sessions were used to gather feedback from the public and other stakeholders to help guide the direction of their work. So you can see from the video that they use some graphics to help depict some of the process. So the way that it happens kind of later on in the video, each of those shapes gets moved into a different shape and then they all end up fitting together into a really nice structure that's nice and stable. So this idea of reimagining the way that things work so that we've got a more stable health and social system. So the idea of using those graphics along with the closed captioning was to help to make the information a little bit more digestible for that general public audience that this was aimed for. And again, the closed captioning was another strategy to increase the accessibility. So one of the things we did for this project was we worked with Perfect Day, which is a local media company, to produce this video. And so something I wanted to highlight in this example is that for graphic design work, cost is a huge piece of that. So it can be fairly expensive. And if that's something that you think you may want, I would really encourage you to look into the potential costs associated with what you're thinking of and budget for that from the beginning. And then something else to consider that was done here. So again, we were looking to reach the general population and we were really looking to get, in fact, input from everybody across the province. So we really had to consider a multifaceted approach. So we had public town halls. These were online because of COVID. In a non-COVID environment, we would have likely tried to make those be in person. We had radio and television ads. We sent out a targeted mail out to areas of the province with low internet connectivity, realizing that those people might not be accessing the information that we were putting out primarily online. And then we were also active on social media. So that was really an effort to reach as much of the population as possible, thinking of different avenues to reach different types of people in terms of how they consume media. So again, just kind of some ideas to think about if you were doing a similar project. Now let's see if I can
to reimagine health and
move to my next slide. Oh, I might have to, let's see here. There we go. Okay, so the next example is a clinician-led project. So this was led by a nurse practitioner based out of our local rehabilitation hospital. So she observed that patients of the Total Joint Assessment Clinic often had a lot of questions about the process, how long various steps would take, what to expect at different appointments, that kind of thing. And so the research team included a patient partner on their team. So the patient partner was involved throughout the process. And early on, they had a bit of a sense that an online pathway might be something that patients would find really helpful to help guide them through this process. So they had several rounds of focus groups with former patients of the clinic, and they did agree that a pathway would be very helpful. Unfortunately, in this project, they had a very small budget. So they were challenged to find a way to develop a pathway, thinking back to the idea that graphic design, online stuff is fairly expensive. So developing this pathway using the funds that they had available was a challenge. In this case, they were really fortunate. The student working on the project happened to have a friend who was a recent graduate, and she was willing to do the graphic design work for free to help build her portfolio. So I'm not trying to advocate for asking people to provide their expertise at no cost, but I do think this is a good example of thinking outside the box if finances are a challenge for the type of knowledge translation product you are thinking of developing. So thinking of if you're an academic researcher, you may have the ability to collaborate with another academic department and provide an opportunity for students to do the work as part of a practicum placement perhaps, or maybe a course project. But again, these are things that if you wanted to do that, you would need to start early in terms of developing that collaboration and figuring out how that would work as part of a student opportunity. So my last example here is this project was on understanding how people realize that they have a hearing problem and then making a decision to seek help. So the goal of the research team was to inform policymakers of the services needed for the hearing loss community and to offer strategies to increase awareness of and accessibility to community healthcare supports and services in the province. So the team developed several knowledge translation products. So they had a government brief. They developed an infographic for distribution among national and provincial hearing loss associations and to relevant healthcare practitioners. And they had these online modules, which is the screen grab I've got up on the slide there. They have a journal publication and conference presentations. So you can see with that list of knowledge translation products, they really targeted different knowledge users in different ways. So they have targeted policymakers, practitioners, patients, and other researchers and academics, but each of those different audiences gets a different knowledge translation strategy based on their needs. So focusing on this online resource, it was developed in partnership with the research team, their patient advisors, and the local Hard of Hearing Association branch. And so what I want to highlight with this resource is that because they partnered with the Hard of Hearing Association, they were able to house the online modules on the Canadian Hard of Hearing Association website. So that link gave them a home for their online modules, which was really great for them. And you can see here that they've also broken their resources into different stages of life. So we can appreciate that there would be different priorities for those different stages of life in terms of hearing loss. So it's important to target each of those groups differently. And you can see just from the little grabs of the videos that they've opted for text in their videos rather than an audio recording. And so thinking of a group that might have varying degrees of hearing loss, text would be much preferable to audio. So again, specific to the population that they are targeting. So now I just wanted to kind of, try to provide a bit of a mix of examples and touch on a couple of points for each. I'm just seeing something in the chat here. Okay, no problem, Christian. We are recording this, so if you'll get an email and you should be able to watch the rest of this at a later date when you've got time. Thanks so much. So yeah, I just wanted to kind of provide a couple of examples for each of those KT examples that I gave earlier, and I've just compiled all of those kind of suggestions here in one spot. But I think the things that I've highlighted a fair bit that I think are really important is that starting early piece. So engaging your knowledge users early and discussing those potential knowledge translation products early so that you can plan, you can budget, you can start asking around about making some of those connections with people that would have this expertise that your team doesn't have. So we've kind of touched on some of the arts-based stuff, some of the kind of technical stuff, the web-based stuff, that sort of thing. And then on the next slide, I've just provided a couple of resources. I mean, you can certainly do some Googling and ask around yourself, but some resources here, specifically if you were thinking of doing graphics, videos, or a website yourself. So these are some resources that can help you do that if that's not expertise that you have in-house, but you want to take a stab at doing that. So now we're going to switch gears a little bit now that we've seen some examples. But I'm thinking you might be wondering a little bit about how you actually figure out how you get to the point of doing a play or a comic book or video, whatever. So I've got a couple of resources later that I think will be really helpful in terms of walking you through this process. And again, your local support unit should be able to help you out with this as well. But briefly walking you through some of the broad steps to think about. Starting off, we really want to consider those target audiences for whatever knowledge you've generated with your research or you're planning on generating. So again, not every project needs to reach every type of audience. You really need to think about the specific people you're trying to hit. So some questions to consider when you're trying to identify those target audiences. So who are the people who need to know about your research? Are there people or groups that might experience a change in how they do things based on your research findings? So for example, are clinicians going to need to change their practice? If that's the case, then you probably want to engage clinicians. Are policymakers going to have to update or adapt existing policies? Yes, probably want to engage policymakers. Maybe you want to do that policy brief as one of your knowledge translation products. Are your results going to affect how patients access care? If that's the case, then certainly you want to share this information with patients so that they can anticipate what to expect if the way they access care is different. So really, who are going to be able to use your findings, and do these findings have the potential to influence current practice, policy, or patient behavior? So, okay, we've determined those key people that we need to reach, but what do they actually need to know? We want to make sure that all of those audiences have the best evidence available to make whatever their decisions might be. So it's really important to tailor our messages to the needs and interests of those specific target audiences. And we know that knowledge needs can be very different depending on our audience. So like I noted in some of the examples, not necessarily a one-size-fits-all message or a one-size-fits-all medium. So like we saw in the hearing loss example, you might end up with several strategies if you're trying to reach multiple audiences. And we all come with different perspectives on what information is important to us, depending on who we are. So if we think to our researchers, they might want to know about the methods and the scientific rigor of the design of your research. A family might care about how this will impact their quality of care and their quality of life. So very different bits of information. A clinician might be interested in knowing how they can provide better care to their patients, or maybe how they can run a more effective practice. And policymakers are probably interested in the impacts on government and taxpayers and how the results might fit in with current political visions. So some other kind of contextual factors are important to consider. So current opinions of the research subject matter. So if you're doing something, say about vaccines, and we know right now vaccines are kind of a hot topic where there's quite differing viewpoints on that, that's something to consider. Your audience's emotional or financial ties to the outcomes of the research, and just generally kind of how they might be invested in the research. So they might be financially invested, they might be politically invested, they might be emotionally invested. So thinking about those things and kind of thinking about that as part of how you're going to target those audiences with your information. And then, we want to get to know our knowledge users so that we can figure out what they need to know. So, it doesn't have to be rocket science. Talking to them is a really great place to start. We know that researchers are invested in their research from a particular angle, but what you as a researcher think is important might not actually be what's important to a clinician or what's important to a patient. So it's really important to talk to them to understand what their needs are. And also how you deliver a message can make a huge difference in how it's received by different groups. So if you're talking to a vaccine hesitant community, it might be very different how you would deliver your messaging than if you were talking to somebody who was very supportive of vaccines. So the goal, again, by doing that integrated knowledge translation approach is if you've developed a working relationship with your knowledge users throughout the project, it's pretty straightforward. You know them, you can talk to them, you can ask them, they should be providing this information to you kind of as you're going. But if you don't, or if you don't have all of your knowledge users represented, reaching out to people that you have existing relationships with can be helpful. But if you don't, and that's okay, it's good to think about kind of carefully who is best to approach. For example, so we've got this example here with government. If you want a government, you think they're a stakeholder and you really want to get information out to them, then you want to think carefully about who might be doing the background research to inform a policy decision. So you probably don't need to go straight to the minister or the deputy minister. On a project, the director or the manager would be a better bet in terms of the people who are actually appreciating the kind of details that go into making a policy decision. So reaching out to them as opposed to going straight to the top is probably going to get you more of the results that you are hoping for. And then in terms of organizing your message, it's important to get right to the juicy stuff when you're talking to people who aren't researchers. So when we think of researchers, they're trained to be kind of skeptical. They don't just want to know what you found. They want to know why it was important to study, how your findings stack up against the body of evidence around that topic. They want to know how you found your results and what might have affected your findings. So in a research setting, we're trained to start with writing or presenting our information by focusing on the background and supporting information. Then we go into quite a bit of description about the methodological information, and then we mention the results. But from a non-academic perspective, they're not particularly interested in all of that. So you want to cut out a lot of that background and methods information and really focus on the results and what they mean for your target audience. So really starting with your key findings and your results first, and then briefly talking about how it fits in with what we know and why it's important. And of course, really remembering to keep it short. So in particular, if we're thinking of policymakers and clinicians, they don't have time to read a 17-page report or read an academic journal for something that might be relevant. So thinking like one page, something really short, easy to read, gets to the point, is going to be your best bet for success with some of those knowledge users. And I wanted to provide a couple of tools before we wrap up. So I'm really hoping you're thinking in your mind about some examples of knowledge translation products that you've worked on, so we can chat about those a little bit. But I want to highlight two tools that I think might help you if you're thinking about knowledge translation planning. And this would be ideal if you're very much at the beginning of your process, but you can certainly jump into these if you're a little bit further along as well. So this first resource is from the Sick Kids, so Sick Kids Hospital in Toronto, their knowledge translation planning template. This is an excellent resource to help you plan out your knowledge translation for a project. So this that I've got up here is just a screen grab from one of the pages. But this particular page is just a nice list of the potential strategies that you could think of based on what you're trying to achieve with your knowledge translation. And you can see there that it highlights that it might be different for different knowledge users that you're engaging. And there's some examples on here that I thought were pretty interesting. Those that certainly didn't immediately jump to mind for me when thinking of knowledge translation, but they could be really impactful depending on what you're doing. So we've got an example there of commercialization, which is not at all something I would have thought of, but depending on what you're doing, that might be a really important knowledge translation strategy. Then we've got, a policy brief. So again, that's kind of the government angle, or in-service training for practitioners. So if you're really trying to get into that changing practice, teaching the practitioners what needs to change and what's new, that would be a great way to do that. So again, if you're just getting started with a research project, I would really recommend working through this template, because it kind of takes you through all the steps of thinking about who you might want to target, when you want to target them, kind of all the stuff I was talking about at the beginning. So it's a great resource. And the next resource that I wanted to highlight, and I thought this might be of particular interest to researchers who really are probably interested in having data to back up their decisions. So this document is from Alberta Health Services, and it lists several different knowledge translation strategies, and then notes the effectiveness for different audiences. So if you're just kind of at the point where you're brainstorming different knowledge translation ideas, specifically if you're targeting one of these audiences, so we've got decision makers, healthcare practitioners, law enforcement, patients and family, public, and researchers. So if those are maybe some of the audiences you're thinking of, this might be helpful. So in the resource, they go into additional detail for each audience, and then they talk about the strategies that they evaluated for them, and then some additional tips for targeting that particular group. So one example is for decision makers, they noted that incorporating local data and contextual factors that impact the local applicability are details that are really important to them. And that they're also really likely wanting to know information about the costs of an intervention, along with the benefits, harms, and risks of it. So if you know that decision makers are a group that you want to target, having that information as you're planning your research allows you to incorporate something like a cost analysis into your work to make it more relevant for that group. And that would be something that would be nice to know at the beginning so that you can incorporate that into your process from the start. So that's kind of my my spiel here. But to wrap up, I'm really hoping that that gives you a little bit of inspiration about some other ways to share your research findings. Knowledge translation strategies are so individual to each project and the interest of the target audiences you're trying to reach. So it's difficult to be super prescriptive on the how, but I hope that there were some tidbits in there that you can consider as you develop your knowledge translation strategies. But I really wanted to highlight that it's, you know, the value of bringing your project team together to brainstorm and problem solve around how to achieve a particular KT strategy or what might be a good idea is excellent. And also, again, your local support unit can help. So they might be able to provide some, again, kind of help you with that brainstorming around suggested strategies to reach specific target audiences, or they might be able to make some of those connections. So if you're trying to, you know, connect with an arts organization, they might be able to help you a little bit with making some of those connections. So I'm happy to answer any questions that people have, but again, I'm hoping that we might have some attendees who are willing to share knowledge translation strategies that they've used for projects they've been involved in. So I'm going to stop sharing my screen, but before we do that, I've got 2 more slides. So just a slide here with my contact information. Always happy to chat about research, so feel free to get in touch if you have any specific questions about your work or you want to share something. Always happy to hear about what other people are doing. And then the last slide here, oopsie, is, whoops, we'll just scroll down to that. It's just a page of resources. So these slides will be posted on our website after this presentation is over. So these are just some resources that might be helpful for you if you're in the planning stages for your research, or you're just trying to increase your knowledge translation skills. And I've got that Sick Kids planning template on here. And then I also have the Alberta Health Services example that I provided as well. So hopefully, those will be helpful for you. And so now I'm going to stop sharing so that I can see you all. And I'm hoping that maybe some folks might be willing to share, or certainly if you've got questions or if you want to share, this is kind of a bit of time for us to just have a little discussion.
Okay, thanks, Kathleen. That was very informative, and you gave really good examples of knowledge translation products. There's a comment, I think, from Jennifer.
Yeah, so I'll turn on my video, but I feel like I should preface it. I don't know if you can see me or not, with an apology. I'm doing some academic writing this week, so I'm working from home. And I don't know if you can see or hear me.
We can, yep.
Oh, okay.
Yep.
Well,
Yeah, background.
yeah, thank you. I'm downstairs working today. Yeah, I always write better with like a messy bun and yoga pants. So like, pardon me for not being like a nice blazer or something in my office. But I thought that was an excellent presentation. I do arts-based research, so I found it so informative to even just go after like, you know, just not the pockets of money, but like local arts groups to be involved with your knowledge translation. I think that's just, you know, such a beautiful idea. And I know CIHR has specific grants for knowledge translation. So I feel like you guys have given me some wonderful things to think about. But I don't know if anyone's on. I do, my spouse actually does work with communications and PR. So if anybody ever need, and for yourself, Kathleen, and your colleague there, Amy, he does videography, like 4K videography, social media blasts, and all that stuff on the side. So I could always give you guys my contact information afterwards, because this is actually, I know someone who's highly skilled who does this kind of work. So yeah.
Yeah, that would be wonderful. I mean, it's helpful for us. Like I was saying, we act as kind of a bit of a knowledge broker for people. So if we know some of those contacts that we can share with people, you know, you're looking for somebody, here's some people we know of to reach out to and get some quotes from. That would be super helpful for our info, because we certainly don't know everybody in the landscape either.
Yeah. Okay. Well, thank you. That was very informative. It was an excellent overview. Thank you.
Any more comments or questions?
So I'm curious if people are willing to share. Do we have mostly kind of other researchers on the line today, or kind of what backgrounds do we have? because maybe I'm asking a bunch of non-researchers to tell me about their research, and that's why we're struggling here a little bit.
It says that a few of them are researchers.
We've got a couple researchers, yeah.
I guess nobody really wants to be the first one to share.
That's okay. But certainly, like I said, feel free to, if you have specific questions or comments, or want to share something, I'm very happy to chat by email. I'll pop my email in the chat as well, if that makes it a little bit easier. And I don't know if everybody is located here in Newfoundland and Labrador, but certainly if you're not, even if you're not, and you have questions and you are hoping to get contacted with somebody local for you, I'm happy to try to facilitate that as well. We've got kind of some fingers across the country, so hopefully we can help facilitate any connections elsewhere as well.
Okay.
But I mean, if we don't have any other, we don't need to keep people from the rest of their lunch hour.
Okay. Well, if no one has any more questions or comments, I'll just got a little something to share before we go. Okay, so I just wanted to share about our research design series. So we have another webinar coming up now in May, from Research to Policy with Cheryl Etchegary. So you can go to the NL Support event page, Eventbrite page to register. And you can also check out past events as well as this one today if you want to rewatch those or past events. We also have a training program. So if you register at nlsupport@mon.ca, you can get a letter of completion if you attend 6 sessions. As I said, you can register for these events on the Eventbrite page. If you have any questions about any of this, you can contact me at amy.hand@med.mon.ca. And there's just our Facebook NL Support page. Stop sharing that. Okay. Well, that was great, Kathleen.
Well, thanks so much for joining us today, everybody. And Jennifer, it was lovely to hear of somebody else who's doing arts-based research. And please do pass along that contact information. We'll add it to our repository for folks who come out to get some help from us.
Oh yeah, absolutely. Thank you guys so much.
Thank you.
Okay, have a nice day.
You
Sorry,
too.
I had such a quiet bunch. It was a great talk.
It was.
Thank you.
Thanks, Kathleen.